Acne. I'm pretty sure we all know what it is. Those annoying pimples and blackheads caused by the nasty buildup of dead skin cells and oils in our skin. Acne sucks, and in some cases, extreme acne can lead to embarrassment and insecurity, impairing self-confidence and everyday functioning, which is why it's important to talk about it. There are lots of treatments for acne, including over-the-counter drugs and topical treatments, with benzoyl peroxide being one of the most prominent. Today, we're going to talk about the Neutrogena Light Therapy Mask. This mask looks a bit like something you'd see from a science fiction movie, covering the entire face and including an eye shield to protect the eyes. On the inside of the mask, there are a bunch of small blue and red lights scattered all over, and accompanying the mask is an activator that provides 30 treatments. Users are supposed to wear the mask daily for 10-minute treatment sessions. The mask sells by its tagline, "Turn on the light, turn acne off," claiming to reduce the appearance of breakouts. But does it actually work? First, let's ask ourselves, why light therapy? Because bacterial resistance to antibiotics is a growing concern, scientists have turned to other methods like phototherapy for potential treatments, especially treatments that could be practical for home use. Examples of phototherapy include UV radiation and laser treatments, but the Neutrogena light therapy particularly uses something a bit more simple: visible light. With that, let's look at the science behind how visible light affects our skin. The earliest research on light as disinfectants found that the wavelength of certain light plays an important role in bactericidal responses, and the shorter the wavelengths are, the stronger the bactericidal effects. The way that bactericidal effects occur is that many bacteria have a high concentration of endogenous photosensitizers, molecules that undergo change when exposed to light. So, with intense exposure to visible light, a reactive oxygen species is generated that damages nearby cell structures, leading to the cell death of the bacteria. Now you may be wondering, why blue and red light in particular? Well, let's focus on the blue light. The blue light specializes in killing bacteria in the skin. When blue light is shined onto the skin, it causes the photoexcitation of bacterial porphyrins, which are chemical compounds accumulated by the acne-causing bacteria, P. acnes. These porphyrins produce oxygen, which in turn destroys the harmful bacteria in the skin. Now, let's explore the effects of the red light. The red light specializes in reducing inflammation in the skin. Although red light is less effective at photoactivating porphyrins, it can penetrate more deeply into the skin tissue. Red light influences the release of cytokines, proteins in the immune system cells, from macrophages to reduce skin inflammation. Together, these blue and red lights work to create the ultimate and most efficient treatment to clear the skin of bacteria and reduce the inflammation caused by breakouts. Another question that pops up is it harmful? There hasn't been enough research to investigate the long-term effects of the mask, but a comparative study conducted by Hessling et al. Reveals that visible light therapy is definitely much safer than other phototherapy treatments. The LED lights used in the light therapy device are not powerful enough to damage tissue and are much less harmful to the skin compared to UV radiation. They also reduce the chances of accidental eye damage compared to laser treatments. The only potential worry that comes up may be the slight warmth felt on the skin, but a study conducted by Lee et al. Mentions that the clinical trials show that the heat might even be beneficial for acne. It all seems a bit too good to be true, right? What's the catch? Honestly, there doesn't seem to be any given its low risk factors. In terms of whether it's the most effective treatment, there are mixed results across studies on whether phototherapy works better than benzoyl peroxide. In a clinical trial comparing the effects of benzoyl peroxide and visible light therapy, the benzoyl peroxide treatment yielded faster results, with a 54% reduction in acne lesion by the end of the 12-week period. On the other hand, subjects under the visible light therapy had a 44% reduction in acne lesion by the end of the 12-week period. But, as always, results really depend on each person's skin to see which treatment will work best. So let's go back to the original question, does it actually work? When you look at the science behind the blue and red lights, the answer is yes it does. Evidence from clinical trials do show improvements in skin conditions after consistent use of the light therapy treatment. In fact, Lee et al. Concludes that the visible light treatment even has brightening properties with its correlation to lowering melatonin. Whether it works better than other over-the-counter treatments is still unclear, but if you're looking for a different approach to treating acne that is safe, pain-free, and practical to use at home, and you have $34.99 to spend, I'd say go ahead and give it a try. Thank you all for watching, and please be sure to like, comment, and subscribe. As always, have a lovely rest of your day. Zot zot!